Myself Jyothi, working as assistant professor in pharmaceutical engineering department. Today I am going to discussing about that pharmacology topic, that is the pharmacokinetics topic. Pharmacokinetics means it's a what drug does to the body, means studying about that absorption, distribution, metabolism and excretion of that particular drug. See what body does to the drug. After entering into the drug molecule inside the body, what our body will do? It absorbs the drug and it distributes the drug and it metabolizes the drug and it excretes the drug. That is that called as pharmacokinetics. What body does to the drug. Pharmacokinetics word, it refers to this what the body does to the drug. It is a quantitative study of the drug movement in throughout the body. Quantitative study means how much amount of the drug is absorbed into the body, that is the quantity, and how much amount of the drug is distributed inside the body, that is a quantitative study, and how much amount of the drug is metabolized by the liver, that's a quantitative study, and how much amount of the drug is excreted through the urine. Studying about that's why it's called as a quantitative study. And for pharmacokinetic properties, it follows this pharmacokinetics, that is absorption, distribution, metabolism and that excretion. It determines these four properties. It determines that onset of action of the particular drug and the intensity of that particular drug and the duration of action. Onset of action means after entering inside the drug molecule inside the body, it will get absorbed. That absorbed drug, how much time it will take to show its a pharmacological activity, that is that onset of action. And intensity, how much it is showing its a pharmacological activity, that is that intensity. And the duration of action, how long it shows its effect. Studying these four pharmacokinetic parameters follows these three parameters: onset of action, intensity of the drug action and the duration of drug action. It will follows these pharmacokinetic parameters: absorption, distribution, metabolism and the excretion. See here how this drug is going to be absorbing through the small intestine. After drug entering into the from the stomach to the small intestine, here only that absorption will be happen. Whatever the food we have taken and whatever the drug we have taken from the small intestine, it has to enter into the circulatory system. See, in this process only the drug molecule also enters into the circulatory system. This is absorption. Next, if the drug is not active, for that activation purpose, it has to go to a liver, that is that metabolism process, changing one chemical form to another chemical form. That's that metabolism, changing one form to the another form. Activation of drug. Activation of drug is called as metabolism, or inactivation of drug is also called as a metabolism. There its chemical form is changing. In a distribution, that activated drug has to distribute it throughout the body through the circulatory system. Means throughout the body distribution means it has to reach to the target site, that is that cell or whatever it is. That's the distribution. Next, the distributed drug, after completion of its pharmacological activity, this onset of action will be completed after completion of its onset of activity and intensity of activity completion. It has to go for a excretion. That excretion is also called as elimination. It happens at the kidneys. It happens at the kidneys. Inside the kidney, nephron will be there. Inside that nephron, that filtration will be happen. That filtering and this elimination of the drug from our body is called as elimination process. These are the four pharmacokinetic parameters. That's what we are telling you, what drug does to the body. Means the drug molecule enters inside the body, means what our body will do means it absorbs and distributes and metabolizes and the eliminated the drug. These are the four processes are played by our body. The studying about these four properties: absorption, distribution, metabolism and elimination, these four properties are called as a pharmacokinetic properties. We'll see this question once. The pharmacokinetics means what now? The study of the biological and therapeutic effect, or the study of absorption and distribution of metabolism and excretion of drug, or the study of metabolism, mechanism of action of drug, or the study of methods of new drug development. Which one is correct? Means as per our discussion till now, the study of absorption, distribution and the metabolism of excretion of drug is called as a pharmacokinetics. Let's see the answer. The answer is a B. This one is the answer. Next, we'll see the definition for the absorption. Absorption, it is a movement of the drug from its site of administration into the circulatory system. We are administering the drug through the different routes like that is called as routes of drug administration. Routes of drug administration means we are administering drug to the different routes like local route and the systemic route. Here local route means topical applications, and the local route means with the help of systemic circulation the drug is enters inside the body. That is the local route and the systemic route. Here this absorption means what? It's the movement of the drug from its site of administration into the circulatory system. Wherever we have administered the drug, from there to the circulatory system, it's nothing but blood. From there to the blood, how this drug is going to enters into the target. Studying about that one is that absorption. Movement of drug from its site of administration into the circulation. And next, distribution. Following absorption or systemic administration into the bloodstream, a drug distributed into interstitial and the intracellular fluids depending upon the particular physicochemical properties of the drug. After completion of the drug absorption, the systemic administration of a drug, if the drug is absorbing through the stomach, through the enteral route means there have a different absorption mechanisms. Following absorption, systemic administration into the bloodstream, a drug distributing into the interstitial and the intracellular fluids depending upon the particular physicochemical properties of a drug. Means this dissolution, this physicochemical properties means it depends upon the drug distribution, it is depending upon the solubility of the drug. Means whether the drug is soluble in water or if the drug is soluble in a lipid, the distribution is depending upon the physicochemical property of a drug. And metabolism, this is also called as biotransformation. Biotransformation means the chemical alteration of a drug in the body by the liver or the other tissues, means changing one chemical form to this another chemical form. Changing one chemical form to this another chemical form with the help of liver enzymes, that is called as biotransformation. Bio means their liver is involved. With the help of liver enzymes, this alteration is happening. That's why it is called as biotransformation. Next one is that elimination. Whatever the drug absorbed, distributed and metabolized in our body, after completion of its onset of action and the duration of action, the drug has to eliminate. That elimination process is done by the urine, bile and the feces. It will get eliminated by these three routes. Urine means kidneys will do that elimination process, and here bile means through feces or through bile secretions the drug will be excreted, and through feces means removal of drug from the body after completion of its activity. Studying about that one is that elimination. These are the four definitions for the pharmacokinetic properties: absorption, distribution, metabolism and the excretion. So metabolism process it is. This metabolism always it happens in the most of the drugs gets metabolized in the liver only. Means see, with the help of liver enzymes, these drug molecules are going to be converting into active compounds. That's called as biotransformation. Liver enzyme cytochrome P450 converts that inactive drug into active drug. That's why we are calling it as a biotransformation. See, after completion of its activation, after completion of its pharmacological property, the drug has to excrete the whatever the metabolites formed in the biotransformation process. That metabolites are excreted through bile, urine and the feces. And this metabolism process also happens for the drug excretion. For that drug excretion process, metabolism is required. And for the drug activation purpose, this metabolism process is required. This metabolism process is played by the most of the drugs follows this liver activation metabolism only, and few of the drugs follows other organs like skin and pancreas. Few of the drugs activated through that particular organs. Next, coming to this next one is that absorption. How this drug is absorbing into the systemic circulation. Absorption, it's the transfer of drug from the site of administration into the bloodstream. wherever we have administered a drug, from that region to it has to go to that particular target. Studying about that is at absorption, and this drug absorption follows four mechanisms. One is that the passive diffusion process, facilitated diffusion process, active transport, and the endocytosis process. See here in the passive diffusion process, movement of drug molecules across the membrane from a region of higher concentration to the lower concentration. Lower regions of concentration means here there is no energy required for this drug enters into the systemic circulation. Movement of drug molecules across the membrane from a region of higher concentration region to lower concentration region means by reducing their concentration gradient, the drug molecules are crossing the membrane. Here drug molecules will be present. By reducing their concentration gradient with water, it crosses the cell membrane, means after crossing it's a cell membrane, it enters into the systemic circulation. For the entry of drug molecule into the systemic circulation, it follows a passive diffusion mechanism. Passive diffusion mechanism means by reducing their concentration gradient, drug molecules crossing the barrier and enters into the systemic circulation. Means how it dissolves, the drug molecules are slowly dissolved, one by one molecule enter and crosses the membrane. Like this drug molecule is absorbing in this passive diffusion process. Most of the drugs are water soluble drugs only. All these water soluble drugs crosses the membrane. By reducing their gradient, it crosses the plasma membrane and enters into the systemic circulation. Here there is no any carrier involved, means there is no any carrier to take it from outside to the inside the body. Nothing is there here. Only by dissolving, how this sugar is dissolved in water, like this drug molecules dissolves in the water and it crosses the membrane. This is a passive diffusion process. And next, facilitated diffusion process. Drug enters to the cell through the specialized transmembrane carrier proteins here. See here carrier protein is there. This is called as carrier protein. Here facilitators will be there. With the help of these facilitators, the drug molecule crosses the membrane. See here in passive diffusion process, here that's completely the drug was dissolved and slowly one by one molecule crossing the barrier and enters into the systemic circulation. Here in the facilitated diffusion process, here one facilitator is there. Here with the help of this facilitator, this one drug molecule crossing the barrier and enters into the systemic circulation. Drug movement occurs from an area of this higher concentration to the lower concentration. Here also by reducing their concentration gradient, by dissolving the drug in the body fluids, slowly it is crossing the barrier and enters inside the systemic circulation with the help of facilitator, with the help of carrier. Here protein is there, carrier is there, protein molecule. See here one drug molecule binds and slowly it sends one drug molecule sends inside the systemic circulation. Like this it will be happen. It does not requires energy. It also does not requires energy. Here also does not requires energy. Simply by reducing their concentration gradient, the drug molecules are crossing the plasma membrane and can be saturated and inhibited by the compounds that compete for the carrier. Sometimes these carriers may get clogged. It can saturate. That type of problems may occur in this facilitated diffusion process. This next process is that active transport process. Active transport process, it involves a specific carrier proteins. There in facilitated diffusion process, there also carrier proteins are there, but there it does not require energy. But in active transport process, here specific carrier proteins are there, but these carrier proteins acts with the help of energy only. With the help of energy for that activation, for the sending of drug molecule from the outside to the inside, it requires energy. That's that active transport. Moves the drug, again is the concentration gradient. In the last two slides we discussed this passive diffusion and the facilitated diffusion. There by reducing their concentration gradient, higher concentrations to lower concentrations, the drug is moved. But here in active transportation process, lower concentrations to this higher concentration, this drug is moved with the help of the carriers. Endocytosis and the exocytosis process. In this endocytosis and the exocytosis process, transport of by using this process, those drugs are having larger molecular weight, and larger drugs uses this endocytosis process and the exocytosis process, generally like hormones and vitamins and the compounds having high molecular weight follows this exocytosis and the endocytosis process. Transport of exceptionally larger drugs, and endocytosis means engulfment of a molecule by the cell membrane. Engulfment. If the here we can't able to cut the hormones into small pieces, and we can't able to cut the vitamins into small pieces. Right, it itself only we need to send inside the cell, and whatever the hormone synthesized inside the cell, like that only it has to come outside to move to this other body parts, right? For the larger molecules, those molecules are having larger molecular structure and the molecular weight, that compounds follows this endocytosis and the exocytosis process. Here endocytosis means engulfment of a molecule by the cell membrane. Cell membrane engulfs inside. See, here drug molecule will be there, slowly it engulfs. It pins that cell membrane, and like that it enters inside the cell membrane. And exocytosis process, it's a reverse process. Whatever the molecule synthesized inside, like hormone, vitamin, or whatever the protein, if synthesized inside the cell, it pinned and to engulfs outside. Like that it releases that hormones, vitamins and the proteins into the target region. Example, vitamin B12, it transports across the gut wall by the endocytosis process. It will be there in a small intestine. For that absorption purpose, it follows this engulfment, endocytosis or exocytosis process, it will follow. The main mechanism of most of the drug absorption in the gastrointestinal tract is, as we discussed, most of the drugs follows passive diffusion process. Here, by reducing their concentration gradient, here it's not required the carriers, and the energy does not require this for the drug absorption inside the systemic circulation. It only requires by reducing their concentration gradient. Slowly the drug molecules enters inside the circulatory system. Coming to these factors affecting this absorption, few of the parameters may affect the absorption of a drug, like pH. If let's say, for example, at fever conditions, our body's pH will be changed in a stomach region. If we can't able to take food, at that time acidic nature will be increased. At that acidic nature, if we took any medication, means the pH will be changed and the drug absorption also slow. Like that, pH alters the drug absorption. And area of absorbing surface. Area of absorbing surface also important, means the drug absorption is faster in elders and slow in youngers. Because this body surface is less, and the elders this body surface is more. That's the reason this drug absorption is high. Like that, this drug absorption is altered by the area of absorbing surfaces and the presence of other substances. If we will take this medication, few of that medications with the food, this absorption affects. And few of that medication, like the tetracycline with milk, if we will take, it chelates the tetracycline, means this drug nature will be changed and it will not be absorbed completely into the systemic circulation. Like that, few of that factors absorbs the drug absorption. And next one is that bioavailability. Bioavailability means the fraction of administered drug that reaches to the systemic circulation in unchanged form. Whatever the medication we have taken, how much time it is taking to reach into the systemic circulation is called as the bioavailability. The fraction of administered drug that reaches to the systemic circulation in an unchanged form. Let's say if we are taking paracetamol, means it should be like a paracetamol in a blood also. It should not change its form. That's an unchanged form. That is a unchanged form. So for example, 100 mg of drug we administered orally. Only 70 mg of the drug were absorbed in an unchanged form. Means the bioavailability of the drug is 0.7 and the bioavailability is a 70%. Remaining 30% drug, what happens? It gets metabolized and the excretion started. And for IV drugs, if we administer the drug through IV route, there the absorption is completely 100%. There is no any other substances to absorb. Here we are directly injecting the drug to the bloodstream only. So there is no other substances to affect. Means pH it will not alter, the area absorption also will not alter, and the other food substances also will not alter if the drug we enter, if we administer it through the IV route. If we will take it in the oral route, means only bioavailability will be reduced because of that the factors we have discussed earlier. With that factors, this bioavailability will be changed. If we will take 100 mg drug, means 70% only enters into the bloodstream and the remaining 50% will be excreted. And this bioavailability, it is calculated by the area under the curve oral by area under the curve IV into 100 oral and the intravenous route. If we will take a graph, time on x-axis and the plasma concentration on y-axis, we will take the medication through oral route. After taking oral route, in a 0 minutes, if we will take a blood sample, we will take a blood sample in a 0 minutes. What was the concentration? It will be 0 concentration only. There is no drug. Oral route. Let's say if we will take drug through the IV route. IV route. At 0 minutes, if we will take the blood sample and if we will check the concentration, means how much amount of the concentration will be 100 micrograms. Sorry, 100% of the drug. 100% of the drug we can see in a blood. That's why we got a value at here. Time and the concentration for IV route at 0 minutes. At 0 minutes, IV route 100% of the drug we can see. That's the value it will come at here. For a oral route, if we will take at 0 minutes the sample, there is no drug will be present in the systemic circulation. That's why this value it will come at here. After 0 minutes, after 5 minutes, after half an hour, after 1 hour, after 2 hours, slowly this drug concentration will be increased like this through oral route. If we will take through this drug in IV route, means at first 0 minutes 100% of the drug we can find. After half an hour, this drug concentration will be reduced. After 1 hour, it's like this, slowly this drug concentration will be reduced. That's the reason this oral bioavailability, it is calculated by the AUC of oral by the AUC of IV into 100. It shows that presence of unchanged drug in a bloodstream. Is called as a bioavailability. It will be calculated like this. Coming to this, next one is the distribution. After completion of drug absorption, distribution takes place. Means this absorbed drug has to distribute throughout the body. This distribution of drug into the interstitial, intracellular fluids depending upon the particular physicochemical properties of a drug. That also depends upon the physicochemical properties on, means water soluble nature, lipid soluble nature, on that only it will depend, this distribution also, right. That's drug distribution follows the lipophilicity of the drug and the blood flow and the capillary permeability, plasma and the protein binding, the volume of distribution depends upon this, all these parameters. Let's see, if lipophilicity is high for the drug, these lipophilic drugs, are highly distributed throughout the body. And whatever the hydrophilic drugs, water loving drugs, these drugs are distributed slowly. And blood flow, this blood flow is very high in our brain, and in the skin this blood flow is very low, means the drug distribution in a brain is very high and the skin is very low, because in a brain so many capillary networks will be present in a brain. That's the reason drug distribution is very fast in a brain. In a skin, we can see only less capillary network will be there. Because of that less capillary network, this drug distribution at the skin is very low. And that too, the brain tissue is very soft and so many capillaries will be present, and the skin tissue is so tough and the low capillaries will be present. That's the reason the distribution of the skin region is low. And coming to this capillary permeability, see, capillary permeability means the drug distribution, this depends upon the capillary permeability of the drug molecule. See, if the drug molecule size is bigger, means this capillary permeability, this capillary will not allow the drug move inside the particular organ. So capillary permeability also plays a very important role. In a liver, this capillary permeability is high. In a brain, this capillary permeability is low. See, in a brain, these capillaries are small capillaries will be present. In a liver, this capillary size is little bit more size. That's the reason in a liver, the drug molecules can circulate easily. In a brain, these drug molecules cannot circulate very easily. Plasma and the tissue binding. Protein binding decreases the distribution. If the drugs binds to this plasma containing proteins like albumin, globulin, and the fibrinogen, these three are the drug proteins present in the plasma. If you are taking any medication, the drug molecules has to bind to these proteins to show it's a longer action. Plasma and the tissue binding. Albumin is a major drug binding protein and it may act as a drug reservoir. After completion of this absorption in a distribution process, drug distribution means it has to circulate throughout the body. As we know, this blood is circulating throughout the body. If the drug molecule binds to this albumin, means this drug can circulate throughout the body and it can reach to the target region. That's why the drug molecule binds to the albumin present on the blood. This maintains the free drug concentration as a constant fraction of the total drugs in the plasma. Means free drug concentration is a constant fraction of a total drug in the plasma. Since the drug binds to the albumin and it shows its activity. And tissues acts as a reservoir of a drug and prolongs its action. Whatever the drug distributed after reaching its to the target site, in the target site means there. In a target site means it is a tissue. Inside the tissue, so many cells will be present. Inside the cell, the drug will be stored. That's why we are calling it as a reservoir. Drug reservoir. Whenever our body requires, at that time that drug will be released slowly and it will show its action. Many drugs accumulated in the tissues. This leads to this higher concentration in the tissues than in the extracellular fluids and the blood. Sometimes this tissue accumulation may lead to the toxicity. Here tissues are acting as a reservoirs. Sometimes it shows advantages and sometimes it shows disadvantages. Means for the slow release drug, The tissue reservoirs acts as a sustained release, and whenever responses will be generated inside the body, means at the time drug will be released, and after termination of that disorder, if still the drug is there in a tissue, means at that time it shows it's a toxicity that leads to the toxicity. Sometimes the tissue accumulation leads to the toxicity. It's coming to the volume of distribution. The volume of distribution is used to quantify the distribution of the drug between the plasma and the rest of the body after oral or parenteral administration, means how much amount of the drug is utilized by the body. Studying about that one is the volume of distribution. Quantifying the distribution of the drug between the plasma and the rest of the body. Target organ, how much it absorbed. If still how much amount of the drug is retained in the plasma. If the drug is administered through the oral route or if the drug is administered to the parenteral route. Studying about that one is the volume of distribution. Volume of distribution. And we can also call it as apparent volume of distribution. So this volume of distribution is calculated by the amount of the drug in the body by the concentration of the drug in the blood plasma. Amount of the drug in the body. Or by the concentration of the drug in the plasma. How much amount of the drug we injected by the divided by the concentration of the drug present in the plasma. If the target is absorbed, the drug means this concentration will be reduced. See, initially we injected 100 mg. Later, if we will check the concentration, means it will be 50 mg per liter. What about remaining 950 mg of the drug? It's taken by the target organ. It is the volume of distribution. Plasma half-life of a drug. Length of the time needed to decrease the drug plasma concentration by the 1/2. Reducing the concentration. Let's say if we are taking 500 mg of drug, how much amount of that time it will take to the drug concentration by the 1/2, 250 mg. But the time taken by the body to reach the plasma half-life of the drug, means length of the time needed to decrease the drug plasma concentration by the 1/2. If we are taking 650 mg dose of 650 tablet, how much time it will take to 325 mg of the drug into the bloodstream. 325 mg of the drug reaches to the bloodstream. How much of the time taken to reach this 325 mg of the drug is called as the plasma half-life. The greater the half-life of the drug, the longer it takes to excrete. If the half-life is greater, means it will take so much time to reach half of the concentration into the bloodstream. Means it will take much more time to get metabolism, and this metabolism is taking so much place, means this excretion also will take so much time. The greater the half-life of the drug, means the longer the excretion. And determines the frequency. Why we need to study this plasma half-life, means for the frequency and the dosages. Say Dolo 650 tablet. This is the first dose. Next dose, at what time you have to take it? After 6 hours. Who decided this? The 6 hours. This 6 hours is decided by the plasma half-life. Plasma half-life of a drug. First half of the concentration of the drug reaching to the systemic circulation, that only decides the plasma frequency of the drug. Dosages. How many dosages we need to take? For every 6 hours, 2 doses or 3 doses or 3 times or 2 times or 1 time. It is decided by the plasma half-life. For that reason, we need to take the plasma half-life of the drug, frequency and the dosage. Thank you for giving this opportunity.
Like, share, and subscribe. Hit the bell icon for more updates.